I'm from Juhi Fertility Center near Juhi, Hyderabad. Today we are going to talk about the management of thin endometrium. Friends, as you know, whenever we examine the patient during IVF stimulation, we will find that the lining of the uterus, that is the endometrium, is thin. What is the meaning of thin endometrium? That it is below 7 mm. So normally the thickness of the endometrium, what we want is 7 to 12 mm. And anything above 9 or 10 mm is very good, which favors the implantation of the embryos. So thin endometrium is a condition wherein we find that the eggs are ready, but the lining of the uterus is not ready. It is very thin. It is around 6 or 6.5 mm or even less than that. So if you transfer the embryos at this stage, they are going to fail because the embryos are exposed to the basal layer. They are very close to the basal layer where there is a high oxidation, and then the embryos will survive. So for the better implantation, you have to improve the endometrium. And what is the reason for this endometrium? The most common cause of thin endometrium is if suppose the woman has had some infection in the past. It's called a chronic endometritis due to any non-specific organisms. Then 2 is tuberculous endometritis, which is very common in our country. If there is any patient who had tuberculosis anywhere in the body in the past, these are the people they should suspect that they have damage to the uterus lining and they should come to the doctor early for the treatment. And then thirdly, you suppose she has undergone 1 or 2 times DDNC, that is dilation curettage. These are the women who develop something called Asherman syndrome. So these are the conditions wherein we find on ultrasonography that the lining of the uterus is less, and these patients they will not be successful for the implantation and successful pregnancy. So we diagnose by ultrasonography, and secondly, these are the patients we subject them to diagnostic hysteroscopy, which is a procedure and it is a minimally invasive procedure, a procedure. The patient is admitted and then they are discharged within 4 hours. It is done under anesthesia, there is no pain. So here we pass a very small thin telescope to the uterine cavity, and then we check entirely the lining of the uterus. Are there any conditions? Are there any polyps? Or how much is the cavity distorted? And then we do the lysis, lysis and correction at the same time. So this is one treatment. Then we take a biopsy and send it for the histological examination to look for any chronic endometritis or tuberculosis. And then once we finish diagnosis, now either the woman will go for a long-term antibiotic or she will go for an antioxidant treatment which lasts for about 4 to 6 months. And definitely it improves the lining of the uterus, and at the same time we give glutamate, detoxified, vitamin E, vitamin C, and hydroxide donor, algidras, and then proven and estrogen replacement, and then we can give them vaginal. So these are all the methods by which we try to improve. Apart from these, if suppose we don't find any reason, then the latest treatment for endometrium management is you have cell therapy. One thing is a platelet-rich plasma, it's a PRP which is injected intrauterine, and 2 is a granulocyte cell-stimulating factor, it's called GCSF, which can be given as subcutaneously 3 doses, once in 2 days, or you can give it given intrauterine. Again, the PRP is prepared with the patient's own blood, so there is no risk of infection. And here the advantage is the platelet-rich plasma. It releases a growth factor cytokines in the uterine cavity, which helps in regeneration of the new cells. This method has been found to be quite effective in our patients, and recently also we had a patient who had a very bad infection, but to our surprise and to her good luck, we injected PRP 3 times, once in 3 days, and the last dose being 2 days before the endometrium transfer. The endometrium improved nicely to 9 mm triple line, and now she is successful in carrying the pregnancy, and she has an intrauterine pregnancy. And then the next is a GCSF, that is called extracellular injection. These are given subcutaneously once in 2 days starting from day 6. And so these 2 methods will definitely improve the endometrium and will do very good business. So if you have any queries, please contact us on this number. Thank you.